Today, we're diving into one of the true masterpieces of medical engineering, the MRI machine. I mean, this thing is incredible. It's a device that mixes quantum physics, supermagnets, and some serious computing power to let us peer into the invisible world that's inside every single one of us.
It's the kind of question that sounds like it's straight out of science fiction, right? But the answer isn't about scalpels or surgery. Nope, it's all about the fundamental properties of the very atoms that make up our bodies. So how on earth does this amazing machine actually do it?
All right, let's get into it. To really understand the MRI, we have to start small, like incredibly small. We need to talk about the unsung hero of this whole story, the simple, humble hydrogen atom.
And here is the absolute key to everything. Your body is jam-packed with hydrogen. It's in all the water, it's in fat molecules, it's everywhere. And that sheer abundance makes it the perfect target for the MRI to work its magic. The machine is basically built to listen specifically to what all that hydrogen has to say.
You see, every single one of those trillions of hydrogen atoms has this quirky little property called nuclear spin. Now, don't let the name scare you. The easiest way to picture it is to think of each atom as a microscopic compass needle, just spinning away on its axis, pointing in its own random direction. So normally, you've got trillions of these tiny compasses all pointing every which way. Total chaos. But the moment you slide into an MRI machine, you enter an unbelievably powerful magnetic field. And that field is like a drill sergeant yelling, "Attention!" Instantly, all those little atomic compass needles snap into line and point in the exact same direction.
Okay, so all our atoms are lined up and organized. Now what? Well, now the machine can actually start listening to them. And this is where the real magic begins.
So here's how it works, in 4 basic steps. First, like we said, the giant magnet aligns everything. Then, step 2, the machine sends out a quick pulse of radio waves. This pulse is perfectly tuned to hydrogen, and it's just enough of a knock to tip all those spinning atoms out of alignment. Then, the pulse shuts off. And naturally, the atoms start to relax and snap back into line with the magnetic field. And this is the crucial part. As they relax, they release a tiny bit of energy, a super faint radio signal. We call that an echo.
And this is how we get a picture. See, hydrogen atoms in different kinds of body tissue, like in your fat versus your muscle, they relax at slightly different speeds. That means they send back slightly different echoes. The MRI is sensitive enough to pick up on these tiny, tiny variations, and that difference is what creates the contrast you see in the final image. It's exactly how a radiologist can tell the difference between healthy brain tissue and a tumor, or spot a tiny tear in a ligament.
So we've touched on the quantum physics of it all, but what about the machine itself? I mean, this thing isn't just a big magnet. It's an absolute engineering marvel, designed to manipulate physics at an atomic level.
Let's just start with a number to put this all into perspective. 30,000. What in the world does that even mean?
Well, it means the main magnet in that machine is over 30,000 times stronger than the entire planet's magnetic field. That's just staggering. And to generate a field that powerful and that stable, the machine has to use coils made of superconducting materials. And get this, those have to be chilled with liquid helium to a mind-bogglingly cold 4 Kelvin. That is colder than deep space.
So the machine really has 3 key tools to get the job done. We've got the big one, the superconducting magnet, which acts as the drill sergeant. But then you have these gradient coils. They make tiny adjustments to the magnetic field. You can think of them as a GPS system, letting the machine know exactly where in the body each signal is coming from. And finally, you have the RF coils, which act as both a mouth and an ear. They shot out that radio pulse, and then they listen very carefully for the faint echoes that come back.
Okay, so the machine has collected millions of these tiny echoes from super precise locations all over the body. That's a whole lot of data, but it's not a picture yet. So how does it turn that sea of raw signals into a detailed anatomical image we can actually look at?
Well, the data it collects first doesn't look anything like a part of the body. It's all gathered in this complex data map called K-space. The best way to think about it is like having all the raw ingredients for a cake sitting on the counter. You have everything you need, but it's not a cake yet. It's just a bunch of frequency data.
This is where the heavy-duty math kicks in. A brilliant algorithm called a Fourier transform acts as the ultimate translator. It takes all that abstract frequency data from K-space and, like magic, converts it into a spatial image. It literally turns those signals into a recognizable picture of our anatomy.
Now, as you can imagine, that translation process takes an immense amount of computational horsepower. Modern MRI systems use powerful computers, often packed with the same kind of graphics processing units or GPUs that you'd find in a high-end gaming PC. They crunch all those numbers almost instantly, building that final, incredibly detailed image slice by slice.
Of course, when you're dealing with a machine this powerful, a magnet that's colder than space, radio waves, cryogenic liquids, you need some serious safety engineering. So how exactly do we tame this titan?
Well, there are multiple layers of safety built right in. You've got heavy-duty magnetic shielding. This is absolutely critical to stop any metal objects from getting pulled into the machine and becoming dangerous projectiles. The system is also constantly managing the radio wave energy to make sure there's no heating of the patient's tissue. Then you've got emergency venting systems for that liquid helium just in case. And the whole room is shielded to protect the super-sensitive machine from any outside radio interference.
When you think about it, it's just amazing. From the quantum spin of a single tiny atom all the way up to super-chilled magnets and lightning-fast computers, the MRI is this perfect symphony of science and engineering, all playing together to make the invisible visible.
It's such an incredible achievement, and it really makes you wonder, as our understanding of physics gets deeper and our engineering gets even more advanced, what other hidden realities are we right on the verge of discovering?